Hello, and welcome to Voices of African Women. Today we'll be discussing HIV and AIDS, an issue that continues to cripple our people, our countries, and the very future of our continent. Many of us have heard of these words, HIV and AIDS, but don't know what they mean. Others of us think that we can never be affected, and we don't want to educate ourselves. Well, knowledge is power. Today we are here to talk about what HIV and AIDS are, how it spreads, and some common myths about the disease. The World Health Organization states that sub-Saharan Africa is more heavily affected by AIDS and HIV than any other area in the world. To give you an idea in numbers, 24.5 million people had HIV by the end of 2005, and last year 2.7 million new cases occurred. Also last year, 2 million people died of the disease, leaving 12 million children without parents. And it doesn't just affect adults. About 2 million children are affected as well. But what are HIV and AIDS? HIV means human immunodeficiency virus, and AIDS is acquired immune deficiency syndrome. What happens is HIV, the virus, enters the body and begins to break down the immune system. Eventually, this leads to full-blown AIDS when the immune system is virtually destroyed and the person is unable to fight diseases. HIV can infect others through bodily fluids such as blood, semen, and vaginal fluids, and also breast milk. A person can get it by sharing a needle with someone who's infected, having anal, vaginal, or oral sex with an infected person, and a mother who has it can pass it to her children during pregnancy, childbirth, or breastfeeding. There is no cure for AIDS, but there are some drugs that will delay the time that HIV progresses to full-blown AIDS. The median time that HIV progresses to AIDS is about 9 to 10 years. But after a person has full-blown AIDS, the median time until death is only 9 months. There are some common myths in our community surrounding HIV and AIDS. The first is that sex with a virgin will cure AIDS. People, this is not true. All it will do is infect the person that the person is having sex with. Secondly, HIV is transmitted by mosquitoes. This is not true. HIV cannot be spread by any kind of mosquitoes. Third, people think that HIV only affects gay men and drug users. This also is not true, as the majority of cases of HIV and AIDS in Africa are spread through sexual contact. Lastly, people think that you can get AIDS through casual contact. You cannot get AIDS or HIV by shaking someone's hand, hugging or kissing an infected person, using the same toilet, drinking from the same glass, or exposure to coughing or sneezing of an infected person. How can you prevent the spread of HIV? First, you can practice abstinence, which is not having sex at all. That's the safest way, but if you are having sex, protect yourself by using condoms. Make sure that you're tested so that if you do have HIV, you can begin treatment as soon as possible and you will not spread the disease to others. Many of us in the community are having sex, but are embarrassed to talk about condom use or asking a partner to get tested. But remember, if you're infected with HIV, there is no cure. And think about it. Would you rather be embarrassed or would you rather be dead? Lastly, please educate yourselves. Learn more about the disease. Please email us at Voices of African Women with any questions that you may have, and we will also be posting information on where to get resources. We hope that this has been informative. So until next time, goodbye Africa and goodbye world.